Henry Ford of heart surgery for democratizing heart care in India.
Whether the patient sitting in front of him is a paying patient or a free patient, that is immaterial for him.
He's built the world's largest and also the cheapest heart care institute.
As a doctor, he is very caring. As a businessman, he is very smart.
He's a man who's proved that a low-cost healthcare model can also be profitable.
It's really a numbers game. I mean, it's really about using large numbers to bring down the cost.
He is Dr. Devi Shetty of Narayana, Hrudayalaya. Spread over 25 acres, 2.5 hours from Bangalore, Narayana Hrudayalaya's health city is the first of its kind in India. It has on its campus the world's largest heart and cancer hospitals, a specialty hospital for orthopedic and plastic reconstructive surgery, an institute for organ transplants, an eye hospital, and even training and research institutes. Every day, 3,000 people make it here, and none of them are turned away, not even those who cannot pay for treatment. In fact, this hospital does 50 to 60 free surgeries a week. Because the man who founded it has one mission: quality healthcare for all, delivered with dignity. We met Dr. Devi Shetty on a busy Friday afternoon. As he took us around the 1,000-bed cardiac care hospital, the simplicity of his business model was striking. Let's take this pediatric cardiac unit for instance. It's the largest such facility in the world and at any point of time handles 50 to 60 cases. This is probably the number of cases that other hospitals would handle in a year. So following the simple economies of scale logic, a cardiac surgery that would normally cost 3 to 6 lakh rupees in any other hospital is done here for a mere 60,000 rupees to a lakh and a half.
A low-cost, high-volume model will give me very different operating leverage on man, machine and material. Across the chain, whether it is for materials, that is drugs and consumables, whether it's for medical consumables, whether it is purchase of capital equipment in terms of medical, large, high-value medical equipments, whether it is in terms of ability to exploit your human resource better.
Any disease affecting the heart, written in the book, it is all here.
This means that 200 doctors in this cardiac hospital have surgeries that they've mastered. It's no surprise then that Narayana Hrudayalaya has a success rate of 95%, better than the best hospitals in the world. When you hear people say that you're the Henry Ford of the healthcare industry or heart care business, you're the operating machine, you're the man who sort of invented the factory model for heart care in India, how does it make you feel?
In a way, I feel happy that India requires 2.5 million heart surgeries a year. Less than 90,000 privileged people undergo heart operation and the others die. So we have to look at some other model.
In the process of building Narayana Hrudayalaya, you've done 3 other heart hospitals. But what was the vision that drove you to start Narayana Hrudayalaya 10 years ago?
Only one purpose, that is to democratize high-tech healthcare. We want every man, woman and a child in this country, if they ever require a heart surgery, they should be able to have it with dignity. We thought unless you adopt the business principles, you can never bring healthcare to everyone. If I do free heart surgery, how many free heart surgery I can do?
This whole business of Walmartizing healthcare in India especially, people say that if you pursue wholesale volumes, you may give up something and that something is perhaps going to be quality.
No, I'll give an example. All over the world it has been proved that a surgeon who is doing 3 operations in a day is better than a surgeon who is doing 3 operations in a month.
Right.
If you want better results, you have to depend on the volume. This is not selling a Rolex watch.
Yeah.
It's a business wherein you have to keep on doing in large numbers from morning till night.
I've heard several things being said by C.K. Prahlad about your business model, about how you go after skills, not credentials, about how you know how to leverage human resources, about how you know how to leverage financial resources. But how do you bring down the average cost of heart surgery from 10 to 20,000 in the US down to, if I'm correct, 2,000 now at this hospital.
Our target is to do a heart operation for $800.
Okay.
And in 5 years we will reach there.
Okay.
Now, how do we accomplish this cost reduction? First thing is, when all the other hospitals are doing 2 or 3 heart surgeries in a day, we do about 35 heart surgeries in a day.
Right.
Last year we implanted the largest number of heart valves in the world.
Right.
Every heart valve maker in America
Yeah.
wants to sell his valve to us.
Sure.
So we obviously control the price. We do about 10 to 12% of the heart
So
surgery.
how much of the cost is brought down because you're able to negotiate and drive a hard bargain with the Gs and the Siemens and the Philips of the world?
35 to 40% of the revenue of a hospital today goes for drugs and disposables.
Okay.
So we are able to reduce that cost by at least 10 to 15%.
Because of the higher volumes,
Higher
not
volume.
because you're moving to a lower brand, for instance, which is the perception.
No, no.
Okay. How do you bring down salary costs? Because if you're going after good talent, I would imagine that you'd have to pay them market linked or market aligned rates.
The interesting thing is, some of the best doctors, surgeons who have reached very, very high level of expertise in their own area.
Right.
They like to work in our organization primarily because globally outstanding surgeons are invariably eccentrics. And if you want to retain those eccentric people, you should be one among them. So I get along well with them because I'm one among them.
So you think you're an eccentric, is it?
If I didn't have the eccentricity, even at this stage of my career, I work for 16 to 18 hours in a day. And I see 70 to 100 patients every day. I do 2 or 3 operations every day. It's only the eccentricity will keep you going.
Dr. Praveen Kumar is a childhood friend and a fellow eccentric.
Whenever anybody in our circle had any kind of problem or issue, I think we would always go to him, and he always came up with a very good solution.
That's true enough. In 2003, when microfinance was still not a buzzword, Dr. Devi Shetty convinced the Karnataka government to launch a micro health insurance program called Yashaswini and another one with Biocon called Arogya Raksha Yojana. This program today covers over 3 million people, each of whom pay a monthly premium of just 10 rupees, and this guarantees them treatment for everything from a broken limb to a cardiac arrest.
Mr. Modi, when he visited Bangalore, Narayana, Hrudayalaya, he heard the story from Dr. Shetty, and he immediately said, we'll be earmarking a couple of places for you. You can come and have a look at, finalize, and there you can build a hospital.
Today, Dr. Devi Shetty is banking on this public-private partnership to reach the tipping point, because for millions of Indians, quality healthcare that is affordable is still a mirage. What is the vision now? If nobody else is willing to replicate your model, you've got to try and be aggressive about your own expansion plans.
We believe that India will become the first country in the world to dissociate healthcare from affluence. We will have a very interesting scenario where we will have millions and millions of people living in the slums with no amenities. But when they are unwell, they will have access to high-tech healthcare with dignity, because government is going to become a health insurance provider and not a healthcare provider.
You know, the battle between healthcare, the healthcare industry and most state governments is about control. I mean, we've got this matter running in courts as well on, we've given you subsidized land, you need to provide free beds in hospitals. Private hospitals turn around and say, we are providing free beds. The matter then goes to court. There seems to be almost an adversarial relationship.
I agree. See, just because they had problem with 1 or 2 corporates, you can't brand the whole range of hospitals as the organizations which are all set to make money. We have a perfect relationship with all the governments. We get land at virtually throwaway price in Karnataka state, in West Bengal, in Bihar, in Gujarat, in Jaipur, wherever we have built hospitals,
So then do
we
you
have a
feel,
perfect relationship.
Then do you feel that it is right then for the government to say that we gave you concessional rent, this is now your obligation and you have to give certain number of beds free, you have to treat so many patients free?
That's the only model which is possible. Future of healthcare will be totally public-private participation. How can we afford to pay 10 crore rupees for an acre of land? Then if you ever pay that kind of money, how will you be able to reduce the cost?
You know, right now what we're seeing is the Rolex and the Omega model. Everybody talks about addressing the masses in this country, but we don't have an affordable private healthcare system currently operating in India, with the exceptions of very few institutions.
You are drawing too much of conclusion based on what is happening in Delhi.
Okay.
Delhi is not India. In this part of the country, if there is a child who is born with a heart problem, if the parents cannot afford, there are so many hospitals who will come forward and do the operation.
Time for us to take a break, but when we return, we continue our conversation with Dr. Devi Shetty, the man who's democratized heart care in India.
Dr. Devi Shetty is always on the go, whether he's counseling patients and allaying their doubts and fears,
হার্ট কন্ডিশন ভালো আছে ঠিক আছে এখন কিছু প্রবলেম নাই
or checking up on children that have just undergone surgery.
nothing in the world makes you happy as much as helping somebody who's in distress.
Or sitting in on a meeting with the suits, planning how to take his business forward.
You've often spoken about how it is children from disadvantaged backgrounds, from backgrounds where they've had to face adversity very early on in life, how it will be these children who will really rewrite the rules of the game. You consider yourself to be someone who's also had to struggle early on because of your father being ill while you were growing up. Does that give you the hope and confidence that India is going to change?
The outstanding doctors all over the world came from deprived background. They have the fire in the belly to work for 16, 18 hours in a day and change the rules of the game.
What does it take to be a good surgeon? You know, take me through what it takes.
Surgeons are not really scientists. We are artists. We are creative people. Like yesterday, I was doing a very major reconstructive operation. So in my own mind, in the morning when I was on the treadmill, I was planning how to go about with the operation. So I would have done that operation in my mind 10 times on a treadmill before I actually did the operation. So a lot of people give credit to the fingers. Fingers are like your needle holder and forceps. The surgery happens here. Outstanding doctors have to go to art school and learn how to paint and draw. Yeah. I used to do a lot of painting and drawing. The other thing what a surgeon has to do, he should be a martial artist, because that will teach you the art of focusing.
When you're doing 5 or 6 surgeries in a day, how do you do it?
We talk in the operation theatre. We talk about anything else other than the operation. There is lovely music at the background. Everybody is cool and composed and nobody screams and shouts. We always insist on having a very large window which will give us what is happening outside. We want to create a very creative environment. Then we can come up with the best.
And this lateral approach is perhaps a result of years spent studying and working in London. But it was an opportunity for him to start a heart hospital with the Birlas that brought him to Calcutta and back to India in 1989. Then he moved closer to his home, setting up the Manipal Heart Foundation near Bangalore.
Manipal Hospital, when he started, straight away it was a big success for us. There are certain things which he wanted to do which he couldn't do when he was in Manipal. So that is the reason probably he decided to start something on his own.
And now there's no looking back. Devi Shetty has been described as the Robin Hood of healthcare by the Harvard Business School, where the Narayana Hrudayalaya model is a study in the successful overlap of humanitarianism, entrepreneurship and the state's ability to allow entrepreneurs a free hand in solving some of society's most desperate problems. And it is the same set of conditions that have prompted Biocon's Kiran Majumdar Shaw to set up the world's largest cancer hospital on the lines of Narayana Hrudayalaya.
We had a good brainstorming session with Dr. Shetty. So it's really a numbers game. I mean, it's really about using large numbers to bring down the costs. And I think that for a country like India is a very interesting model. So based on that, I said, okay, I'm going to help you kickstart this hospital. And therefore, I invested in this hospital with the the one objective of making sure that we address this huge challenge of affordable cancer care.
They have a large interest in cancer drugs, and they will be able to produce whole new range of medications at a fraction of the price. And also, because of the large size of the hospital, we will be able to attract thousands and thousands of patients. We are creating a bone marrow transplant unit where in one floor there will be about 15 rooms of bone marrow transplant. It's the largest bone marrow transplant in Asia.
Okay. But is the eye on profits for you now?
Irrespective of your intention and the concept and philosophy, you have to be profitable. Every day we have a P&L account.
Right.
By 11 o'clock in the afternoon, all the senior doctors, all the senior administrators get a SMS with the previous day's performance, how we have done till the month. So everyone knows exactly where we are, whether we are making money or whether we are losing money.
Okay.
Because we are working with a very thin margin.
Right.
So you can't afford to look at the P&L account at the end of the month. Because if you are looking at the P&L account at the end of the month, it's a post-mortem. Whereas when you are looking at the P&L account on a daily basis, it's a diagnosis.
Work in progress, yeah.
Yes, you can change it.
Yeah.
So this is the way we monitor the cost.
The Narayana Hrudayalaya Group currently has 5,000 beds in India and aims to have 30,000 beds in the next 5 years. This will make it the largest healthcare player in the country. But that isn't enough for its founder, Dr. Devi Shetty.
Where are you headed next?
Our target is to create a low-cost heart hospital in Mysore. This is a project where traditionally a 300-bed heart hospital costs about 80 to 100 crore rupees.
Okay.
This hospital will cost, including equipments, about 16 to 20 crore rupees.
Okay.
And a traditional hospital takes 2.5 years to build.
Right.
This hospital can be built in 4 months because this whole thing is prefabricated. We want to bring heart care to 100 cities of this country, and we want it to happen within 3 to 5 years.
But you will require significant funding to be able to execute these plans. You have brought on board AIG, you've brought on board JP Morgan. Are you going to consider listing? Would that be an option for you?
No, I think listing will restrict a lot of things, a lot of eccentric things we want to do. There are a lot of strategic investors who are interested with our dream. We are building a hospital in Cayman Island. Hopefully our hospital will be ready within a year.
Why the decision to go to Cayman Islands? I mean, Cayman Islands for India means a tax haven, means all of your sort of,
American healthcare will undergo a lot of traumatic changes. It's very expensive, and I don't foresee the cost of healthcare coming down in US. Cayman Island is the nearest offshore destination to US, and Cayman Island is the only country in the world where an Indian doctor, Indian nurse, Indian technician can go and practice, because they changed the law to accommodate our request.
And in this, he's not alone.
We may not see eye to eye, but we walk hand in hand because we want to achieve the goals that we set out, because it's very dear to us. And since we kind of founded the whole thing, we have tremendous loyalty and to have and commitment to this purpose.
Along with Shetty's band of eccentric doctors are his sons. His eldest son is a civil engineer and was responsible for building the last hospital.
Second son, he is a doctor, he is planning to do cardiac surgery. The third son is in medical college, and his daughter is in school.
As a schoolboy, Devi Shetty's inspiration was Dr. Christian Bernard.
There is a very interesting saying by Dr. Christian Bernard that pediatric cardiac surgery differentiates the men from the boys.
But it was Mother Teresa from whom he understood his purpose in life. to relieve the agony of children with heart disease and take the road less travelled.
When I reach 60, I want to spend most of my time in Africa.
Okay.
I told my family members, I told my wife and children, this is my dream. Because Africa needs help, and we are very, very keen to be part of it.
What is your advice to people? Because I believe you're a teetotaler, you're non-vegetarian perhaps a couple of days of the week, but otherwise mostly not. Breakfast for you is cornflakes and curd and you know, an hour on the treadmill every day.
I strongly believe that this is the best way to enjoy your life. Because if you are an exercise fanatic, if you are very conscious about what you eat, you remain healthy, remain fit, and you can work long hours.
You've been called all sorts of things, from the operating machine to the king of hearts even. So what would you like to be remembered as?
I want to be remembered as a competent cardiac surgeon. That's all. I don't want to be called anything else.
A competent surgeon with an eccentric streak and a firm belief in Walmart's approach of leveraging economies of scale. Dr. Devi Shetty is on a mission to bring down the cost of heart surgery to $800 over the next 5 years. His journey with Narayana Hrudayalaya over the past decade has certainly proved that low-cost healthcare models can also be profitable. Do send us your feedback and your comments to the Sultans of South at network18online.com. We'll see you again next week. Till then, from all of us here, goodbye and thanks for watching.